our session. Myself, Muhammad Fazil, a PhD scholar in the Department of Sociology, Maulana Azad National Urdu University, Hyderabad. I would like to invite you all to the last plenary session of the 2 days International Conference on Politics of Gender, Health and Digital Initiatives in India. The theme of this technical session will be WASH, Sexual Reproductive Health and Gendered Realities. The session will be chaired by Anju Arora. She is founder Nari Women Wellness Initiative, Hyderabad. We have eminent international scholars who will be joining from UK and Ghana. They will be joining and presenting their papers in this session. So first of all, I would like to introduce the chair of the session. Anju Arora is the founder of Nari Women's Wellness Initiative, a Hyderabad-based social enterprise dedicated to improving menstrual health and sustainability. With over 7 years of experience in health and wellness advocacy, she leads a team of 17 women at Nari's cloth pad production center, promoting eco-friendly menstrual products and job creation for rural women. Anju's work has impacted over 50,000 girls and women, distributing 15,000 period care kits and preventing approximately 4 million single-use pads from reaching landfills. A TEDx speaker and a Women Leaders India Fellow, she is recognized for her contributions to sustainable menstrual health, education, and environmental conservation. Under her leadership, Nari has conducted numerous outreach programs, workshops, and advocacy campaigns that have positively impacted the lives of thousands of women. Ms. Arora's work reflects her dedication to creating inclusive, informed, and healthier communities. With this brief introduction, I would like to invite Chair to take over the session. Over to you, ma'am.
Good afternoon, everyone.
Just a minute, please. Good afternoon, everyone. Good afternoon, all the presenters as well. Hello, so nice to see each one of you. It's an absolute pleasure to honor such an important session on WASH, sexual reproduction and health rights and gendered realities as part of MANUU's international seminar. I've been introduced here. I'm Anju Arora, founder of Nari Women Wellness Initiative, and I've been working in domain of sustainable menstrual health. I work very closely with adolescent girls and women on menstrual health, community education, and sustainable livelihoods. The themes of today's sessions are related to sanitation, sexual and reproductive health, and gender, which are not only urgent, but from a policy and academic standpoint are deeply personal and lived realities for many of us working at the grassroots. Today, we are privileged to hear from our scholars and practitioners who bring insights from across India and beyond. They will help us explore how issues of access, agency, and inclusion interact with intersect with gender, infrastructure, and health systems. I request all speakers to please stay within the time allotted so that we also have space for an interactive discussion at the end. So let's begin. I'll start to introduce our speakers. Yeah, we'll have Ms. Bushra. Yeah, Dr. Bushra. So I would like to welcome Dr. Bushra Sadiq Faisal Hassan. She would be talking on gendered sanitation, investigating the influence of user behavior and toilet design on SARS CoV2 exposure in shared sanitation facilities. I invite you, Dr. Bushra. Yeah, I hope they are.
Just check with
Yeah.
Hi, good afternoon.
Audible.
Shall I begin?
Yes, ma'am. तीन लोग रहेगा. Okay. 1, 2, 3. This will be Vivian. Okay. From Ghana. Okay. Her topic is this one.
Okay.
Only 3. All are
Okay. Okay. Can I also have? Sorry. Yes, Dr. Bushra.
Sorry, shall I start?
Yes. I'm sorry. Please, let's begin. Thank you.
Okay. Would it be okay if you just go back one more slide, just the introduction slide, please?
Introduction slide. Introduction slide.
Just going back the other way, sorry. If you,
मुझे एक पेन चाहिए रहेगा.
It is the.
Okay. Thank you.
Slide 1. Yes. First one is there.
that's it, thank you. Okay, so thank you for the introduction. I'm Dr. Bushra Hassan, and I did my PhD at the University of Leeds under the WaterWiser CDT PhD program. So as you can see on this slide, I have my overall thesis title, which was the impact of behaviours on transmission of respiratory infections in shared sanitation facilities. Next slide, please.
Not bad inside.
So in this presentation today, I'm going to focus mainly on my fieldwork in Delhi, in India, which focused on assessing how the design features and conditions of communal toilets influences user behaviours in informal settlements. And I conducted my case study in an informal settlement called Anna Nagar. Next slide, please. So my main research objective for this particular research was to assess how the influence of design and conditions of communal toilets had on gender-specific and spatio-temporal behaviours and on willingness of users to be able to use these toilets. Next. So from the literature, it was clear that there are several factors that influence how people use and experience communal and public spaces. So the first factor that influences our use and experiences is the physical design. Also, the layout of an infrastructure impacts how we use it and how we move around this infrastructure. The maintenance of the built environment is also a very important factor that influences use and experiences. And finally, the presence and the behaviors of other people influences how an individual uses or experiences a setting. And in my particular case, I was looking at communal toilets. Next. So in my field work at Anna Nagar settlement, I conducted 4 different phases to the study. First was a physical inspection of the layout and the condition of a community toilet complex, which had 2 sex-segregated sections, one for a female section and one male section. I also conducted household surveys to understand toilet behaviours and usage patterns. And I supplemented this with direct observations of footfall and the temporal usage patterns within the communal toilet. And finally, I conducted focus group discussions that helped me to explore behaviours and attitudes towards using the CTC during the COVID-19 pandemic. Next. So this is an aerial view of the Anna Nagar informal settlement in Delhi. This is comprised of just under 700 households, which most of them were semi-pucca houses, and the population was approximately 5,000 people. Next. So before conducting the study, I conducted some transect walks around the settlement, having a look at the different types of sanitation facilities there were across the settlement. So as you can see, we have some individual latrines, There were also the presence of different types of community toilets. But what was very clear across the whole settlement was the condition and the maintenance of the different sanitation services there were across the settlement. Next. The other issue was that of shared points. So many households don't have access to their own water points at home. So there are shared water points across the settlement, which obviously impact the ability for people to share these and come together, which could then impact disease transmission, particularly during the COVID-19 pandemic. Next. So this is an image of the actual community toilet complex, which I focused on for my research. So here you see images from the women's section of the CTC. So as you can see, this is an open plan where, there's open air, there's very rich ventilation. However, the maintenance and the conditions of the toilets were quite poor, where the toilets were only cleaned once a day, and this usually happened in the afternoon. As you can see also, you have in picture C is the hand washing facility. However, here what we noticed was there's no running water to these facilities, and the hand washing facility was actually in poor condition, which basically influenced people's ability to wash their hands. And what we found was that not many people were washing their hands. Picture B actually shows that the facility also includes a laundry section as well for women to do their laundry. But what we found is that women actually didn't want to do laundry in this facility because of the lack of running water. Next slide. Again, these are more photos from the women's section of the CTC. And what we can see is through the design, there were certain infrastructure placed to try and enable better health outcomes. So we have a sanitary pad dispenser, we have an incinerator as well, but again, neither are working. So the purpose of the actual CTC was to try and improve the facilities for women. However, because of the lack of maintenance and the lack of operation, a lot of the infrastructure in there is not usable. Next. And here we have images of the men's section of the CTC. And as we can see here, these are simpler than the women's. There wasn't, so they didn't have a section for laundry because this was something that was purposefully designed in the women's section only. So the men's section was just made up of cubicles and bathing sections as well. Next. So because disease transmission is influenced by what we touch and what we come in contact with in a certain setting, it was quite important to try and list down, what surfaces were available in each of the sections, to then understand whether there was a heavy influence of disease transmission in one section of the toilet than the other. So what we found is that in the women's toilet, there's a lot more surfaces that can be potentially touched by individuals in there. A lot of these were cleaning products such as buckets, floor cleaners, brooms as well. Whereas with in the men's surfaces, a lot of the surfaces were just those that were related to the usage of the toilet. So they were cubicle surfaces. There was the taps and the lota as well. Next. So as I mentioned, I conducted some household surveys to try and understand usage patterns. So from questionnaires with household members, we found that the highest usage times were between 6 a.m. and 8 a.m. in the morning, both for women and men. And then there was a less steeper peak between 8 p.m. and 10 p.m. as well for both men and women. Next. So to understand this empirically, we also conducted a footfall count where we counted the number of people using the CTC, both the women and the men's section, during different times of the day for 5 days in the week. And we found similar patterns to those that were reported in their household surveys. So again, most people were observed to use the toilet between 6 and 8 a.m. And there was also a peak later on in the evening as well. Next. So we also wanted to understand the reasons why people avoided using the community toilets. And the main reason that came out of this was unclean toilet conditions. And this was mainly reported by women. Another issue, which was a significant concern, particularly for women, were non-disposed sanitary pads. And this was something that was observed during our observations of the community toilet complex, where we found a lot of sanitary pads that were undisposed of in waste bins and were left in cubicles. They were left near the bin, but not in it. And this attracted a lot of flies and unhygienic conditions. And many women reported avoiding using the toilet complex until they knew that cleaning had been done in the toilet, which usually happened, as I said, in the afternoon. So a lot of women were withholding from using the toilet complex until then because of the concerns, particularly around unclean conditions and non-disposed sanitary pads as well. Men mainly reported that the reasons they avoided the community toilet was due to waiting times in queuing, and that was mainly during the morning times. But we also had other issues that were reported, such as the lack of maintenance, lack of water supply as well. Some antisocial behavior was also a reason for avoiding the toilet. And also cleaning ongoing in the morning. So people avoided the toilet when they knew there was cleaning that was ongoing as well. Interestingly, concern with evening use was not reported much. So in past literature, we hear that especially women avoid using the toilets during the evening because of privacy or safety concerns. But during the questionnaire, this was not reported as much for this particular community and this particular CTC. Next. So the final data collection that I did was focus group discussions with locals, and this was done to understand their perceptions and attitudes towards using communal toilets during the COVID-19 pandemic, and also to discuss any design interventions they considered to be effective in reducing the risk of transmission in communal toilets. Next. So what the focus group discussions highlighted was that a lot of individuals during that time from themselves, they try to physically distance themselves as a means of infection avoidance. So many of them reported that if they were to come across someone who looked like they were symptomatic, they would avoid using a cubicle that was near them, or they would use a cubicle that was on the opposite side. Women predominantly reported that after using a cubicle, they wouldn't stay behind to wash their hands or do any hygienic activity within the CTC. They preferred to actually leave the toilet as soon as they can and continue hygiene practices at home. So that included sanitizing, washing their hands at home. But as I said, they try to avoid spending as much time in the CTC as possible. Another factor was preventative hygiene measures within the CTC that were carried out during the COVID-19 pandemic. So this includes individuals who reported that they would actually come into the toilet complex wearing face masks, they'd wear gloves or poly bags around their hands to try and avoid any surfaces. Just to try and reduce the amount of cross-contamination. So a lot of this was were interventions or so protective measures that came from people themselves rather than from the authorities themselves who were trying to make the CTC safer or try to reduce the infection risk during the COVID-19 pandemic. Next. So in summary, I've kind of come up with the 3 main points. So first of all, what was found was that the temporal patterns of toilet use are strongly influenced by hygiene conditions. So I found that morning peak toilet use coincided with the most unhygienic conditions because the toilets would not have been cleaned from the afternoon up until the next afternoon. So this exposes users to higher contamination levels when they have limited alternatives. Next. Also, poor infrastructure and maintenance of the CTC significantly affected the willingness of people to use the facility. So because of persistent hygiene issues that were cited mainly by women, it discouraged regular use of the CTC, and this increases the risk of infection risk as well. Next. And then behavioral patterns shift markedly under the influence of COVID-19 pandemic, and this compounded existing avoidance behaviors. So during the pandemic, users adapted their behaviors such as distancing, choosing cubicles carefully, and altering hygiene practices to reduce infection risk. And this highlighted how poor community toilet complex maintenance shifted the burden of safety onto the individuals themselves rather than on authorities who tried to improve the safety of using these CTCs during the pandemic. And then finally, women's hygiene behaviors reflect a complex interaction between perceived and actual risk. So women often delayed hand washing to minimize the time they were in the CTC. So this was during the pandemic. And they did this as a protective strategy that unintentionally increased shared health risk. So by not washing their hands straight after using the toilet, with the perception that they can wash their hands when they leave, they then kind of create a shared health risk as they expose themselves to other people in the community. So this highlights how gendered coping behaviors can be shaped by inadequate infrastructure, but how it can impact other people in community as well. Okay, and thank you for listening.
Thank you, Dr. Bushra. Thank you for thank you for presenting your observations on such an important topic. I think these were very important observations. And thank you for also concluding it within the time. Thank you. I would now open the floor for any questions. Do we have any questions from Dr. Bushra on the recent study that she presented? Any questions?
If I can do, otherwise.
Yes, please.
Bushra, that was really very impressive field. I don't know, just wanted to know more about the pictures and then, picture presentations about the toilet and the buildings. Do you really find this influence the behavior of the girls in the school in terms of their menstrual health and how toilet practices also minimizes the presence or in terms of environment of even in Delhi? We have seen in the past in some of the studies that young girls were not having toilet facilities in terms of proper water into it, infrastructure
the rooms were not cleaned, so they would not use rather than skip the schools. So did you find these connecting dots into the school where you did some field work?
Sorry, the first part of your question, there was an echo, so I didn't hear you properly. Could you just quickly repeat it again, please?
Yeah, that does the infrastructure facilities of the school influence the behavior of the girls attending it in terms of menstrual health practices and not attending schools because of lack of proper toilet facilities?
So in my research, I focused mainly on the community toilet complex that was used by the community itself. So I didn't do any work around school facilities. But I mean, from previous research and literature, we know that lack of infrastructure, especially around menstrual hygiene, impacts girls from actually going to school during that time. But as I said, that was not an area of focus for my PhD because I was mainly looking at households and their use of community toilets that were available in their area.
Assalamu alaikum, Bushra.
Walaikum
Can you hear
salam.
me?
Yes.
Yeah. Bushra, my experience in the rural areas in Karnataka, the experience is very bad, I can say. There were toilets, public toilets. People were not ready to use it because there was no running water. And there was no sanitation worker or anybody coming and cleaning. Your pictures have been, very encouraging to see, comparatively very clean. I think you have taken when they were not in use. And especially what Dr. Zia has raised is also an important aspect. Like for girls, many of them in India, a major cause of dropout after 5th or 6th standard, after they reach puberty, is lack of water, running water, or lack of a toilet facility, or incinerators. Have you tried to, cover schools as well?
No, I haven't covered. So, as I said, I didn't cover schools. I mainly looked at shared sanitation facilities within neighborhoods and communities. But I think the issue is kind of similar across different settings, where what's happening is you have facilities that are being built. Sometimes they're being built with the amenities and the infrastructure that's required, but then they kind of downgrade over time because there's no maintenance, there's no staff who are actually operating and keeping these facilities maintained. And so over time, they become not fit for purpose. And this is, for example, the community toilet complex that I focused on. This followed the design regulations of what a community toilet complex has to look like through like the design specifications that are mandated. But again, without the maintenance, without the operation, it doesn't matter how many great, you can put an incinerator in there, you can put a pad dispenser in there, you can put a hand washing facility in there, but then if it's not being regulated and operated well, then it makes no difference in terms of hygiene. So again, this could be the case in schools as well. It's the maintenance needs to be put there, even if the infrastructure is basic.
Thank you. Thank you for sharing that, Dr. Bushra. I also have, one sharing here. While I had been working in this space, there was a very short stint with, we having to engage with the municipal corporation in Hyderabad on the toilet, usage, the community toilet usage. And it came because, we had we had done some work on encouraging toilet behavior among school children, school girls in the government schools. So the challenge that we faced were, they were definitely building, the toilets left, right, and center, the community toilets. But yes, as you rightly pointed out, maintenance was the challenge. The infrastructure was the challenge. The toilets were built, but then the accessories or the spare parts, they were being damaged or stolen, and leaving the citizens to not be able to use the toilets appropriately. And after some time, it just became like a dumping yard. I also believe, apart from being able to provide the infrastructure, I feel it is also important to empower citizens with the right right awareness, right education, as to, or empowering them with the fact that how they can take collectively the responsibility of managing the toilets, and then making it collectively usable for everybody. I'm not sure, what do you think about it? I would like to know your perspective on this.
Yes, I think that's a really important point. And actually, during the focus group discussions, this was something that the women themselves were discussing, because, as I mentioned in my presentation, one of the biggest concerns was the undisposed sanitary pads. Although there were waste bins available, they weren't being used as well as they should be. So one of the points the women made was needing to raise awareness between themselves and education between themselves to understand like how to maintain the community toilet complex as well as they can without the maintenance from the municipal authorities. So that just, that would entail like basic hygiene education, understanding how to like maintain the cleanliness of the cubicles, understanding basic menstrual hygiene management as well. So these things are something that are important, but it should never get to a point when it's burdening the community itself to take it all upon themselves and use their resources, when it should actually come from the municipal authority, because they have more resources, and they should kind of complement community efforts rather than it being put all on the community itself to try and burden. Because what we know ends up happening is that it becomes the women who take on that burden more than the men. So it'll be them who will do the cleaning. It'll be them that will have to manage the infrastructure. So there's got to be a gender balance within the community, but it should also be balanced with what's the municipal authority and the public sector actually doing to help with the overall maintenance, because it mainly falls on them predominantly than it is on the community, because they have more resources than the community.
Sure, I understand. We have a question from the audience. I would request them to come over. Okay. Please hand over the mic. Thank you.
Thanks, Bushra, for that very interesting presentation, very well organized. I just had this one comment about the last point that was made by the chair regarding the collective responsibility of managing those spaces, which you sort of re-emphasized. I was just wondering, how do you do it in a country like India? And while you spoke of gender equality and men also sharing the load, any question of hygiene, maintenance of sanitation of spaces, taking care of waste disposal are also very caste-ridden questions in India, right? So inevitably, when you talk about community taking a very proactive role in managing sanitation and hygiene in toilets, the burden of this is unfortunately going to fall on the Dalit community in India, on those who work from the manual scavenging sort of groups. And the politics of caste would really prohibit others from engaging in this type of labor, which is deemed to be a caste-based occupation. So while at an ideological level, this may look like something that is workable, unless there is a reform around practices of caste, this may not be a very fruitful perspective to adopt. Thank you.
No, thank you so much for raising that. That's something that I'm aware of, but not very fully knowledgeable on. So thank you so much for raising that. And yes, I think the matter of caste is quite significant in India. And so, as you said, even if there's collective efforts from community, this is something that will definitely have to be looked into, so it doesn't fall onto one caste over another.
Yes.
The car goes into that system, automatically gets washed and comes out. Similarly, in community toilets, do we have a system? Can we look forward to have such things that now manual scavengers is banned in India? Can we have an automated, mechanized system where automatically they are cleaned by the machines without any human intervention every 1 hour in communities? I think we should go for it and explore the possibility and pulling the industry to it, whether they can develop such a machinery machines into that. Thank you.
Thank you for your point. Yeah, I mean, about the point of manual scavenging being abolished, I'm not sure whether that's been fully implemented yet. But yeah, that's something that definitely every country should work towards, is ending manual scavenging where possible, and moving to more technological means to try and prevent people from disease transmission through manual scavenging. But thanks for your point.
Thank you, Dr. Bushra. Thank you, sir, for asking that question. Thank you for raising the concern as well. You're very right. It's unfortunate, how the caste system prevails in our country. However, collective responsibility may not be a fact, or may not be a possibility at this time. Perhaps we can always look towards it through means of education and being able to empower. Yes, technology. Yeah. Yes. Yes, you're right. Yeah. Yes. I agree. I agree. Thank you all for sharing your insights, making this an engaging discussion. I hope, we can really address these issues, in another sitting. And I think it is really important to at least talk about them, voice about them, because unless we talk, we highlight, there is no way we can look for solutions and being able to address it. So thank you so much. Moving on to the next presentation, I would like to invite Spurti, Ms. Spurti Kolipaka. She would be presenting her research on gendered narratives, WASH education in stereotypes, a rigorous review of what are gender narratives in LMICs. Welcome on board, Spurti, please.
Hi, thank you so much, Anju. Can you see my screen? Can someone confirm if my screen is visible?
Yes.
I'm sharing. Yeah, perfect. Thank you. Yeah, namaste and good afternoon, everyone. My name is Spurti, and I'm soon entering my final year of PhD at the University of Leeds. I'm also in the same program, Waterwiser CDT, along with Bushra, and I hope to graduate like Bushra did as well. I also thank Professors Shahida and Zia for giving me this opportunity. My research is decolonial and transdisciplinary, using perspectives from both schools of civil engineering and political science. I grew up in Hyderabad, and my decade-long experience in India's social sector has inspired my research. Washed in Stereotypes is the first out of the 3 papers required for my doctoral project here. So women and girls bear the brunt of water and sanitation crisis. Women face safety risks. Fetching water away from home keeps girls out of school. Some of these narratives, which we also heard in the previous discussion, these are some of the water gender narratives used in the 2023 JMP report, which had a special focus on gender. The JMP, or the Joint Monitoring Program, is led by WHO and UNICEF, where the report on global wash progress, which largely shapes the global advocacy, action, and research. We are not disputing the potential for gender impacts through water system improvements, especially when majority of women and girls are made responsible for it. But we're looking at how this discourse rarely interrogates the very gendered division of labor that has made women and girls responsible for it. A lot of these narratives tend to adopt a very linear problem solution frame without accounting the complexities of social transformation, such as gender, caste, class, power relations, which evidence has shown to shape both water access and gendered labor. These narratives, or stylized facts, are most likely myths. Cheryl Doss, in her paper Women in Agriculture, presents how these popular claims do contain a kernel of truth, but are not necessarily based on sound empirical evidence. The language framing matters because it skews our mental models around gender in development. It negatively influences the program design, exaggerates gender disparity, and obscures the need for better data, and subsequently may hold progress on gender equality. And the concern lies in how often gender gets depoliticized with limited engagement in gender power relations or intersectionality. So in this context, these are the research objectives for this paper: to identify and examine the key gendered narratives in the water sector across LMICs. So this is a global study. My first paper is global, the second is regional, and the third is very local. The second objective is to critically appraise the quality and the underlying assumptions underpinning a lot of these claims, and finally to synthesize these findings. So systematic review is, of course, very common and popular, but we've used something called a rigorous systematic review, which was guided by the ODI's toolkit, which provides a reflexivity space required for social science while adhering to the core principles of systematic review. We also aim to go beyond the description of findings and provide a new interpretation of existing data, thus taking the form of a critical review as well. The underpinnings of feminist political ecology provided a framework to examine the interconnections between environment and gendered power relations, especially to unpack the gendered knowledge popularizations and their underlying assumptions. Systematic searches were conducted on 5 databases using keywords around water and gender. We included all articles on rural piped water supply in LMICs that have been published in the SDG era, that is from 2015 to 24, because a lot of these debates have been long-standing. And I wanted to also see what has changed post-MDG. Have we learned from the lessons during the MDG era and what's happening in SDGs? We used Ryan AI, which is a free software for screening, along with EndNote. We analyzed all sections of the papers using inductive thematic analysis. My note here is our work also reflects the dominant discourse of gender binary and heteronormativity concepts of gender, and we hope for more inclusive analysis in future. Now, for the quality appraisal, we built on previous templates from different systematic reviews using a ranking system of high, medium, and low, which means it is inherently a very subjective process. And this is where rigorous reviews are also helpful, as they provide that space for reflexivity, especially in decolonial and intersectional projects like this one. We use two parameters. The first is the relevance or the usefulness, looking at the aspects of author positionality, use of feminist theory, heterogeneity in terms of fairly representing different viewpoints. And the second being trustworthiness, which was about the rigor in research design. We also included participant correspondence to see how many authors disseminated or engaged with the communities post-publication. So this is what it looked like, which was quite an exhaustive exercise and took several months together. So for results, we finally included 48 studies across 26 countries, and there were different research methods with 22 qualitative, 14 mixed, including quant and RCTs as well. Three narratives that we examined in this review was first that gender quotas enable women's active participation in water committees. The second being lack of household water facilities puts women at violence risk. And the third is improved water access leads to time savings, enabling economic empowerment. In today's presentation, I'll discuss the first narrative in detail, but the effort is anytime we come across any such wash and gender narrative, are we able to question some of these narratives? So on the quota system, a total of 21 studies based in 11 countries looked at the participation of women in water governance systems. And participation through gender quotas emerged in early 1990s, influenced by the neoliberal ideas of decentralization promoted by the Bretton Woods institutions and other international agencies, and has long been challenged. SDGs too continue to emphasize women's participation. Participation has largely been well conceptualized, meaning to influence decisions, contributing to overall governance, go beyond group membership, and how they're able to represent others' interests. Some of the key findings are definitely the quota system has increased women's representation in water governance. However, it largely remains inadequate. And despite explicit legislation with different stipulations, be it 33% or 50% in the committees, the result has largely been the same, that the quota has not been met. The few instances of the quota success or a women committee success were when it was all women, like the case of self-help groups in India, or when it was to a very small number, such as 2 women per committee. Yeah, and of course, unsurprisingly, it is not just the quota that is unmet, but the entire committees itself have been found to be dysfunctional. And there was this one particular study where they saw no change even after a decade, which also makes us question a lot of these quota systems or the committees that we tend to see in a lot of infrastructure-related development projects, especially in rural areas. So even when the quotas ensured women's nominal representation in water committees, entrenched gender hierarchies and local socio-cultural norms often limited their actual influence. The chairperson, which is the highest position in the committees, were predominantly held by men, and women were typically relegated to roles perceived as less influential, such as treasurer, which were often justified by gendered assumptions around trustworthiness and domestic responsibility. And of course, tasks such as cleaning were deemed to be feminine, whereas repairing was seen to be masculine. There were plenty of structure variations as well, different names, different types of committees across. And there were some additional roles. So typically in a committee, it is a chairperson, secretary, treasurer, and remaining the members. But then there were additional roles that we could see, such as there were 2 vice chairs, there was an additional technical officer. In rare cases, the rule was everyone is on the water committee in the village. So a process of institutional bricolage is observed. which is defined as the process whereby the stakeholders of natural resource management institutions do not always strictly adhere to formal institutional rules, but instead reject or reformulate them to suit their needs based on their locally and socially rooted beliefs. And institutional bricolage is something that I'm exploring in my paper too as well. And even when there were election processes for the selection of these committee members, it was largely a negotiation or a consensus seeking effort. And even when people believed that women had an equal chance of participating and leadership in these water committees, they were actually stymied in their ability to do so. There was also a very interesting critique of the sole decision making, which is often used as a parameter in Western feminist literature. But in a lot of these spaces, seeking support and acceptance of their family was also considered quite important. And experiences have been completely diverse, and the context really mattered. And the women could be deemed brave or noisy depending on that context as well. Few negative outcomes of gender mainstreaming have also been observed, where women have been coerced to attend these meetings under false self assumptions that there is something to earn financially by attending these meetings. Also, instances where women found their condition to worsen because of the labels and assumptions of the water committee. NGOs have been found to become very fluent in the gender talk of the quota system and women in committees, but rarely able to articulate why is the quota system important or why their representation and participation actually matters. What changes is it going to bring in their lives, or for that matter, in water governance as well. And also another case where even when women were still comparatively doing their roles on the water committee, they were still waiting for men to do the actual repair work or take some serious decisions. A process of committification has also been observed of late with plenty of committees. One study actually saw 94% of women and 83% of men were also in other committees, which also gives us newer ideas to explore about these committees and committification happening, especially in countries like India, with every new program launching a new committee as well. So quotas have neither fully achieved its desired goal nor shifted attitudes to enable female leadership in local water governance in rural areas. The assumption that representative participation improves broader governance and distribution remains unproven. Even if equal participation were to be achieved in these representative spaces, there is no evidence that it is transformational in isolation. We also looked at two other narratives, the second one being the water-related gender-based violence. The portrayal of water scarcity as a source of violence against women simplified a complex issue. While some risks exist, the dominant discourse often reinforces patriarchal ideas of women's seclusion and vulnerability. And these fear-based narratives discount women's agency and their rights to public spaces, often overlooking systemic and male accountability. Survivor voices too remain largely absent, and popular research on wash-related gender-based violence lacks methodological rigor and feminist grounding. And similarly, one of the most popular narratives where time savings are usually linked to economic empowerment rested on a lot of flawed assumptions, because studies revealed that several factors define if the time is saved, how women choose to use it, and whether they have the power to choose. And without control over land, assets, access to markets, or decision making, time alone does not translate into income or empowerment at all. So finally, through this review, we add and contribute to the call for an intersectional lens to counter the tendency to homogenize women and girls' experiences by highlighting the need for context-specific analysis and practice. To conclude, we hope that collectively we're able to reflect and resist the use of such narratives in our daily work and ask, who are these narratives benefiting? How can we better capture the complex everyday experiences of water users and managers? How can we better illuminate the complexity without oversimplification? Thank you so much for your patience. And this QR code takes you to the preprint of this paper. I just heard back from my peer review and I'm yet to update it with details. Thank you.
Spurti, for very insightful presentation of this topic. Any questions from the floor? I would open the floor for the questions, discussions, insights. Yes, indeed. Very neat presentation. Compliments.
Thank you.
Yes. So we have a common question.
Thanks, Spurti, for that presentation. Indeed, fascinating. Just a very quick question about your observation regarding what you call institutional bricolage or even simplification, right? And while you're right in your observation, in India, for almost everything, we see formation of multiple committees and all of that. When it particularly comes to the initiative that you are talking about, do you think the rising institutional bricolage, as you call it, or sort of entry of multiple players into decision making, is it serving some really innovative purpose? Because seem to use the term, I don't remember the exact term, but you seem to indicate that they're thinking through novel methods and so on and so forth. Or is it also something that may really dilute the purpose of the committee itself, possibly bring in more chances of money laundering, I don't know, funds being improperly used or not being used for their purpose? And also, when these random positions are created, who are the occupants on these positions? Are these women? Are these men? So if you can throw light on some of these questions, that would be helpful. Thank you. Again, a great presentation.
Thank you so much, and very valid questions. I would actually answer using the fieldwork. So I started this project in 2022. I just managed to about complete it, but I spent about 2 months in rural Gujarat last year as part of my ethnography as an extension of this paper. And I was questioning two things. So when it comes to these formal rules, are we seeing a process of institutional bricolage where rural communities are really adapting and reformulating to their own terms? Or is there a process of isomorphic mimicry where we're simply copy pasting these narratives from global, national to local? And what I saw in Gujarat is a mix of both. And that is why, again, context really, really matters. And not just at a village level as well, even within the village, the spatial location really matters, because you see both the processes there. There is both a copy paste, simply because there are other committees that are functioning that way, or whether through isomorphic mimicry, because the structure itself is saying, hey, you need to have these committees, and then you have these committees. And to answer your question, where, how do these new positions serve them? I think, again, it really depends on case to case. There was this one case which was actually suggested by the local government, saying, hey, this is a model case. It's an all-women Pani Samiti. They're doing really great. You should go. So when you go to the village, the first thing I notice is the actual Pani Samiti members on the website are complete different people. But the Pani Samiti or the water committee that is actually functioning and serving in reality is completely different, right? So in terms of recognition, credit also, it's completely different. And at the first instance, you'll feel like, okay, these women are doing really great. They're functioning really well. And then when we went into the FGD, we asked them, how did you constitute the group? How do you decide the rules? How do you collect the funds? Where do you save it? What do you do? They were simply looking into the other room, and there was a man sitting inside that room. Right, and he was really supporting all of them in doing this action. But because there is no space for us to capture the contribution of that man, we simply erase his contribution. And it only has to be about female empowerment or all women's Pani Samiti. So there's no role on paper, at least for that man. In the same village, there was a whole different group called Devi Pujaks, who are actually a tribal community, but for some reason have been denoted as OBCs. And they survive on just like water tankers and lesser safe water practices. In other village, again, there is whole different ideas of water committees. On paper, they have additional roles, but not necessarily it is linked to funds. Sometimes it is also maybe linked to just a position that, as a ward member, or I'm a committee member and I'm just on the board. And it doesn't necessarily translate to action either. All of them are struggling for water together as well. So it's really highly context specific. And also like the water tables, the water quantity, the water quality, all of that also are shaping how this committee actually functions, or if they actually are functional. Yeah, I hope I answered bits of it.
I like this notion of committification, and I was wondering whether Jaspal Bhatti's play, it's a TV serial you have seen, and if you have seen, then you could relate it with your own understanding and insights of committification. Thank you.
Thank you so much for such a lovely reference. I didn't really grow up with TV, and Hindi is also, yeah. I think I might need to learn better Hindi to truly grasp, but I'll definitely give it a look. Yeah, I think commodification is still something that we're seeing like very new. At least from my experience as a WASH practitioner, I can confidently say that in large parts of rural areas in the country, there are multiple committees already. So water has a VWSE, Village Water Sanitation Committee, that is led by Water Department. There is another VWSE that is led by Sanitation Department. So at the village level, it is the same members, but at the national level, Sanitation Department is different, Water Department is different, and they're again laying down different criteria. Then there is Atal Bhujal Yojana, which was about source rejuvenation, and there's a separate committee. There is local river management committees, watershed management committees. You have your Narega committees, your social audits, SAGs, of course. So there's clearly lots of committees, and I really hope we'll see increasing papers around committification as well. Because is it that committification is an easier response for governance to say, hey, there's a committee, they're looking at it, rather than taking accountability? Yeah.
Valid thought. Thank you. Any other questions or sharings? If not, we'll thank Spurti. Thank you so much. Yes, please. Yes, please.
Maybe for committification, Weber's notion of bureaucracy, how you'd relate as a sociologist or as a social scientist, that is something you may like to do it. Thank you.
Lovely. Thank you so much. Yeah.
Thank you. Thank you so much. Thank you, Spurti, once again for a very interesting and insightful presentation. And moving on to our next presentation for the evening, I would like to invite Vivian Sia from Ghana. She would be talking and presenting her research on multi-layered exclusion in water decision making, the Fulani people's experiences in Bamboi, northern Ghana. Welcome on board.
Yes, thank you very much for the opportunity. Good evening to the panel chairs, and good evening to everyone. All protocols observed. Please, can you hear me? Hello? Please, am I being heard?
What are you asking, Vivian?
Okay, can you hear me?
Yes, we can hear you.
Okay, wonderful. So thank you once again for the opportunity to present to you today. And my presentation is titled Multi-Layered Exclusions in Water Decision Making, the Fulani People's Experiences in Bamboi, Northern Ghana. So what I basically want to share today, and to also reconcile with what Spooty and Dr. Bushru have shared, is that water problems are virtually the same across a lot of contexts, although there are a lot of intersectional issues involved in various contexts. So whilst I was listening to Spooty and Dr. Bushri, I realized that there are a lot of the issues they are raising that can be also be found in Ghana. And I was like, okay, it's not just about Ghana, but it can also be found in India and a lot of places. So I am a final year PhD student at the University of Leeds. I did an ethnography in northern Ghana, and this is an excerpt from the ethnography. So when you go to Ghana, you realize that we have 16 administrative regions, and these are the systems the government of Ghana work with. We practice a centralized form of government. But when you come to the country, you realize that we have two boundaries, the northern boundary and the southern boundary. Although these are not administrative boundaries, they are virtually imaginary boundaries, and they have been a creation from colonial administration and also subsequent elite African government or Ghana government try to maintain that. So if you want to understand the dichotomy between the northern and the southern part of Ghana, it is basically about the kind of development or the concentration of infrastructure in these areas. So when you go to southern Ghana, which is closer to the capital of Ghana, Accra, you realize that there are a lot of concentration of infrastructure projects there. But when you go to the northern part of Ghana, where I did this ethnography, you realize that there are limited infrastructure development there. That is the imaginary boundary we have created in Ghana. So you realize a lot of places in the north, they don't have good access to water facilities, they don't have access to education facilities, and also sanitation facilities. So generally, this is a problem there. So if you look at this background picture I have here, this was a picture taken from my ethnography. And in this picture, you see me standing there with something white on my head, and you see a head of cattle, and also you see two women standing by my side fetching water from there. So the scenario is trying to draw attention to the experiences of these particular people called the Fulani people. Whilst I go through the presentation, this will make a lot of sense to you. Okay, so basically this will be my outline, give a background. I will give a map of the study area and a problem hotspot of the study area. Then I did a participatory map with the area. I will show it to you. Then I also throw light on what exclusion within exclusionary boundaries or multi-layered exclusion means in the context of the presentation, and also some conceptual reflection to trigger our thinking about how water exclusion can also affect health and other issues. And I particularly scope into the Fulani experience and conclude the conversation. So this is the background. Like I have indicated earlier, Ghana is demarcated into two imaginary boundaries, although administratively we work in 16 regions, but we have two administrative boundaries. So Bamboy is a village in the northern part of Ghana. It is basically made up of a population of 5,000 people. And the major ethnic group in the village is a minoritized ethnic group in Ghana. So when you go to the village, you realize that the more ethnic group, they are the majority or the native majority there. But when you bring Bamboy or the more ethnic group in the context of Ghana, you realize that it is a minoritized ethnic group. That is very important for the conversation. And the location, like I said, is in the northern part of Ghana. And also one major thing that makes Bamboy unique in the northern part of Ghana is that the northern part of Ghana is actually a savanna area, so water issues are a major problem. But when it comes to Bamboy, the Black Volta River passes through the village. So somehow they have access to water. The quantity of water is there, but the quality of water is an issue we will discuss later on in this presentation. And if you come to West Africa in itself, the Volta River or the Volta Basin is one of the major basins in the West Africa. And interestingly, Bamboy is a downstream of one of the tributaries of the Volta River Basin, that is the Black Volta River. And it is a main source of water and economic activity of the area. So if you look at this particular picture, you realize that there is a bridge on the river, and that bridge serves as a trans-ECOWAS transit point. So you realize that the village has a lot of trading activities because a lot of people will transit from the southern part to the northern part of Ghana, and also because Burkina Faso is a landlocked area, they use this particular area. So you realize that there are a lot of business activities, trading, selling food along the river, and also so many other activities going on around the village. So whilst Bamboy has access to this particular river, so obviously, like I said, quantity is there, but the quality they don't have access to potable water. And it comes back to the conversation about the prioritization or the demarcation of the country into the northern and the southern part, and how development is driven along, or development is shaped along these areas. So the context of water struggles here is, I have issues here to discuss. The first one is the country factor. So, like I said earlier, this has been a colonial creation. When the colonial administration came to Ghana during the colonial times, or during the period of slavery, they were interested. They came through the coast anyway, because they came through ships and other form of transportation. So they were basically based as a coastal areas, and also they were interested in resources like gold and other stuff. And you find some of these things concentrated in the southern areas. So they created roads and also education infrastructure for their children. So you realize that these development activities were concentrated there. So when the new government also came in, it's like they still have their national capital there. So development is somehow centered around these areas. And obviously, when a lot of investments are going into Ghana, they go to this particular area. So the government is driven to provide water and other infrastructure activities within this particular southern side, whilst it ignores the northern side, because it doesn't make economic sense, and also it doesn't appeal to the government, successive government. So attention disperses from the capital. Once you move from the capital towards the north, attention is dispersing in terms of infrastructure development. Then we also have a district factor. So apart from the 16 administrative regions, you realize that we practice a decentralization form of government in Ghana, where we have metropolitan, municipal, and district assemblies. And these are demarcated along population lines. So Bamboy is part of the Bole District Assembly because their population is not up to a municipal or a metropolitan. So when it also comes to the district factor, the kind of money or the kind of finance the government allocates to the district is not also as the municipal. And then again, because we have a lot of tribal or ethnic groups within these regions, the people who are administering the district finance try to prioritize their ethnicities than some of these minor ethnic group like the Mo people in Bamboy. So they have major issues dealing with the kind of prioritization the district does, and also the kind of ethnic issues that go on. So you realize that Bamboy is a very comparatively a big village as compared to some of the villages in the district, but you realize that development is prioritized there, coming back to these ethnic priorities and so many issues that people raised during my field work. And also the locality factor. So whilst you realize that the Bamboy is well drained because of the Black Water River, when you enter into the village itself, the water tables are very deep down. So they have tried as much as possible to drill boreholes, but in a short period, these water, the water from the boreholes will go away, and it will, like, you will see a borehole there, like a fiscal facility there, but you pump and water is not flowing out of it. So these are major issues, and also the financial aspect for the village in itself to be able to mobilize itself. And even when an NGO or the government is able to provide some of these water facilities, you realize that they cannot maintain them. Why? Because this is a village, and also because of the water table and other issues, people will try to pump as much as possible to get water. Over time, these facilities will break down, and they are unable to maintain them because they don't have the technological capacity to maintain them. So these are issues. And even beyond the technological capacity, the village is made up of 5,000 people, and per the planning standards of Ghana, a village around 5,000, they are supposed to get a small town water system, which is like a complex system. Meanwhile, they have only hand-dug boreholes. It draws attention back to the country factor, prioritization, and other issues. So obviously, when the people are more over the infrastructure, then over time, they will have to maintain it and repair it, another issue, which they don't have the capacity. So that's their scenario. And also the private sector has realized that, okay, indeed, the government doesn't have the interest, but then there is an economic interest, because once again, the village is the connects the Trans-ECOWAS road. So there is this kind of trading ongoing, like I have indicated earlier. So the private sector has provided tabs there, but the cost of them, mind you, is not everybody who has the capacity to do trading. And there are a lot of people who are poor there. So it draws attention to the multi-layered exclusion we have in Bamboy. So people cannot afford water because the private sector, their interest is about profit making and so on. So I'm coming back to another form of exclusion. These are a group of people we call the Fulani or Fube people. So the Fulani people are basically migrants from the Sahel regions into various places in West Africa. You find a lot of them in Senegal, Nigeria, and so forth. Some of them are living in Bamboy. And obviously, they are not Ghanaians and they are neither the Mo natives. So one thing that has happened is that whilst Bamboy suffers the general challenge of discrimination within the scope of Ghana, the Fulani people are also suffering this kind of discrimination. So because they are basically nomadic people, so they move along with cattle. It goes back to the first picture you saw. So the picture in the introduction, the cattle belong to this Fulani person. So once scarcity is already there, water scarcity is already there, and Fulani people are coming for water, then there is this kind of conflict between them and the natives there. And interestingly, you will find, I mean, they have physical characteristics that will make you easily identify them because their skin is somehow fairer than the average Ghanaian, and they have characteristics like Northern African people. So the moment somebody sees them, then it triggers the kind of conflict around the resource use and other issues. So they are highly discriminated. So they don't want to go around the Blackwater River, this particular river, nor other village water facilities that are somehow potable for drinking and other uses. So you find them using water resources around the fringes of the villages because these are the areas they would like to settle. And these water resources are highly contaminated. It goes back again to the picture I had in the first slide. You could see that the water itself is contaminated, and the cattle drinking from it also further contaminated, because if there is any mad cow disease or any disease, then obviously it's being transmitted to them straight away and so on. So that has been the situation of the Fulani. So the next conversation will really be driven along the Fulani and not Bamboy in itself. Okay, so this is the map of the study area. It shows the water problem hotspot. So if you see the green spot, the big green spot there, this is the area where water problem is a major issue. And this is basically where the Fulani people are concentrated. So if you see the center of the village, you realize that there are a lot of concentration there. You have, although, like I have said, the borehole facilities are not working bad. They have some of them. Private systems have some water system. Meanwhile, the water hotspot area, there are none. There is virtually none borehole or any other system there. And these are the areas where the Fulani people live. So basically, this is what I want to draw attention to. And the second one is a participatory map I made with the village people. Unfortunately, you are not able to see it well, but the people joined me to map the area where they have major infrastructure and other issues and where their water problem issues were. Okay, so now I have come back to how we will understand exclusion within the exclusionary boundary. I think the subsequent presentation has drawn attention to the general water problem in Ghana and that of the northern part of Ghana, and how Bamboy in itself is driven or is shaped around this water problem, and how the Fulani people who live within Bamboy also have a water problem. So when I was trying to conceptualize this whole conversation, I was really enthused to go along with the concept of intersectionality, because usually when we are talking about water problems, we talk about the gender side of issues, but we realize that there are multiplicity of factors that can exclude people from water decision making or access to water beyond just gender. Then it goes back to the conversations Puti raised, that somehow the narratives are driven this way. But if you look at the narratives, you realize that there are a lot of issues beyond just what we say or what the dominant narratives are. That is why I was driven by intersectionality and also feminist political ecology to look at the situated issues that are happening in Bamboy with respect to access to water. I mean, looking beyond just gender, because obviously if a person is a Mo person, the person will be, and the person is a female. So for instance, a female Mo person will be well positioned than a male Fulani person. So this is how I wanted to conceptualize issues for the discussion to be. So when you talk about exclusion, then obviously we are talking about an interplay of intersections that disadvantage a group of people. So for instance, if you pick a Fulani person or you pick a Fulani male, you realize that there are so many issues like their ethnicity, their skin color, and so many interplay that exclude them from water decision, which a Mo woman will not be excluded or discriminated against. So this is how we have to conceptualize and look beyond the dominant narratives of gender and other issues to look at the multi layers of exclusion that people experience. So if you want to understand more about the Fulani people experiences, you can look at Tona. He writes a lot about that. So I was also looking at how IWRM in itself has been conceptualized, how it has been conceptualized to include people in water issues so that they can be part of decision making and they can address their problem. So I have realized that whilst IWRM has been very instrumental, you realize that the social participation aspect is so close. You don't really understand the dynamics because it's important. It highlights gender as an important issue. But when you go into the issues of gender, you realize that there are so many intersections that differently position people, which make their experiences with water exclusion quite different from other people of the same gender cohort. So, for instance, if you pick two female in Bamboy, one is a Fulani person and one is a Mo native, you realize that their experiences of water are different. Meanwhile, when you go to IWRM, it will say gender inclusion, like Sputi was highlighting, put a quota of women there. But when we are putting a quota of women, are we going to get a Fulani person there? This is something that has to trigger our thinking about the social principles of IWRM. So obviously, when we are talking about water problems in the world today, we are talking about natural scarcity and also artificial scarcity. So the issues about Bamboy is somehow artificial scarcity. They have a huge river there. So like I said earlier, the quantity of water is there. But then because of the kind of social exclusion and discrimination and behavior of the more ethnicity against the Fulani people, they do not want to access this space. So this is an artificial scarcity. They don't have the water at all, not to think about treating it to make it quality or somehow manageable for use. So these are the things you have to think about. So I have some few quotations here to highlight from my field work about how the Fulani are excluded. So for instance, they are excluded from participating in chieftaincy actions like other residents. So just like other people in Bamboy, the Fulani people are not allowed to participate in chieftaincy issues. So when you go to Bamboy, beyond the national structures I have indicated, they have customary structures like the chiefs and other people which are inherited. They are not allowed to participate in the chief decision making or any other thing. Meanwhile, when you come to water issues, these are the spaces where the conversations are started and people are chosen. So it tells you about how their exclusion is. So I interviewed the key informant and he said, we are not allowed to take part in decisions at the palace. But when there is an urgent matter that I need to seek support from the chief, he always opened his arms for me. I am returning from his house. That is why you did not meet me at home. So I had gone to interview him. He is one of the main leaders of the Fulani people. So he was trying to draw my attention that they are not allowed. But let's come to think of it, he is a male. So somehow he has access to the chief. But when you go to the area, you realize that the women are completely cut off from anything. Meanwhile, if you look at the first picture of this presentation, you realize that it is the women who are fetching water because the men are going traveling places with the head of cattle and other issues. So the second issue is about identity discrimination. It is very unique to them. So like I said, their skin color is quite lighter than the average Ghanaian, and their hair nature and everything makes you know that, yes, this is a Fulani person going. So it is quite easy for them to be discriminated than other. For instance, if you have a Senegalese in Ghana today living in Bamboy, it is very difficult to discriminate the person because the skin color looks like a Ghanaian. But then if it is a Fulani who had even lived in the village for 20 years or something, it is very easy to identify the person and discriminate them. So I had an informal conversation with a group of people, and one said, if not because our elders are money conscious, how would they have allowed Fulani to be trading around the cheese palace. So once again, the Fulani have some cattle trading around the village during the Saturday market in the village. And the people were so beefed that this is what somebody had to say. So it draws your attention to the multi-layered, the whole issues about how they are discriminated, and for that matter, how they are discriminating for accessing water and other infrastructure spaces. So cultural discrimination. If you go to Bamboy, they have a water priesthood structure, which because of time I cannot be able to explain. And like other residents, not everybody in the village who can have access to or be appointed as a water priest, because it is particularly for a specific kinship within the Mo ethnicity. That's the Kora form. So if you are not a Kora member, I mean, you are even a Mo native and you are not a Kora member, you are excluded. So generally, the Fulani also experience this kind of discrimination, which is quite common in the village. And also discrimination from public forums, like I have indicated. Even if they are buying food from the village, you see somebody call it, oh, Fula, can you live here? It's like they have been discriminated, So if there are public forums where conversations have to be triggered, where discussions have to be made. For instance, when I was in the field doing my data collection, there was an incidence of some companies coming to mine from the village, which potentially could affect the Blackwater River and other water sources in there. There was a village forum. You wouldn't see them there. They don't even dare cross there because they don't want to be discriminated. So they have, over time, they have been conceptualized, or they have been conscientized to live away from such spaces so that there are not encounters between them and the people of the village. So my concluding questions, I come here with these questions. How does IWRM thrive amidst these complexities, complex bridges? We are talking about gender issues. People are accessing water that are unsafe for them, especially women. How does IWRM engage these people in a better way for them to draw attention to some of these water problems, and possibly they can be solved? And I want to ask again, is IWRM enough to even solve water problems? Because if we talk about natural scarcity, we know that global water is dwindling and other issues. But what about artificial scarcity, where we have water resources there, but because of some of these discrimination against the Fulani, and obviously there are women being the major target, how do we solve such artificial creations? Because water is there, but they can't access them because of these social structure and other issue. And once again, I want to find out, is social participation in IWRM a reality or a mirage? Obviously, this is concerning because we are talking about social participation, but people who live within the society are discriminated and other issues. These are questions I want us to discuss, or if anybody has answers, we can all think around them. So I have some few references here, and thank you very much for your time. Thank you. I can hear. I can hear.
Can you not hear me?
Yes, now I can hear you.
Can you?
Yes, now
Okay.
I can.
Okay. So I was just thanking you for shedding the light on such an important and often neglected issues like, and the themes like intersectionality, water governance, and exclusion. What really stands out is the important need to recognize how marginalized voices are often left out from the decision making around vital resources like water. Thank you once again. Your research has really reflected how our governance systems are deep rooted in with systemic inequalities. With this, I would like to open the floor for questions, and I had a question from the gentleman sitting here. Sir, please.
Yeah, thank you for. Am I audible? I hope I'm audible.
Yes, you are.
Yeah, so very interesting, rich data you have. My query to you is that in exclusion or inclusion, in resources, why you are not considering the notion of power, Max Weber's notion of power? I see that your concern in conceptualization revolves around identity, ethnicity, ethnic group, if I understood correctly. But then uh, there is no mention of notion of power. Power could be, and then also that, like, how do you see in accessing those resources, gender or power or class, or in Indian situation, it is caste also. We have lots of studies on that. So would you like to respond?
Yeah. Okay, thank you very much for the question. This is very interesting. So I have a full PhD for this one, and I just pick an excerpt to do the presentation. If you have access to my full PhD, issues about power is discussed, Foucault's conception of power, how fluid power is, and how you may think, for instance, the presentation I just made, you may think all Fulani people do not have power, but somebody may have economic power, and behind the scene, they may be influencing the chief's decision in the village. So this is how I conceptualize power. Yeah, so these are conversations I have had, and also I have read and also referenced a lot about Sultana's conceptualization of power and caste in access to water in India itself. I really read her a lot, and True Love, how they have done a lot of work in India and a lot of places in Asia. So these are issues I have raised in the PhD in itself, but I felt that this conversation, I mean, I didn't want to expand this conversation around that line, but obviously that's a very good observation there. Thank you.
Thank you, Vivian. Mike, please. We have another question.
Hello.
Hi.
You have mentioned that one of the cultural practice that priesthood and include exclusion of some communities from that, whether that practice has also related to access of water.
Whether that practice also is related to, please, the last part of the question.
You have mentioned one of the cultural practices there and in exclusion of some communities, and whether that is related to the access of water for that communities.
Sorry, I'm not getting the last part of the question again. Whether it is related to access support. Sorry, I'm not getting that
Uh,
last part.
the cultural practices of your community and access of water.
Okay, access of water. Yes, indeed. Sorry, I'm my bad. Yes, it indeed affects access to water. So if you go to Bamboy, it's not just about Bamboy. A lot of places where you find such large surface water bodies in Ghana, they have spiritual priesthood. So in their conceptualization, they think that the water bodies are not just water, physical water bodies. They think they are spiritual entities. There are some spirit in them. They pray to them. So for them, unlike how the modern world or how science conceptualize purification, these people believe that there have to be some spiritual purification of the water bodies so that catastrophes do not happen to the village, because they believe that once people are accessing the water spaces, they might have done certain practices, especially they might have gone against some taboos or done certain things that will trigger the anger of the spirit in the water. So the water priesthood is instituted to spiritually sanctify the river. And if you go to Bamboy, it is the Korafon, that is the one of they have 6 kinship groups. The one that is in charge of this spiritual purification of the river is called the Korafon, and they have a male priest and also a female priestess. So they have access to or they make decisions to accessing the river. So, for example, these are issues I didn't want to go into, like I said earlier, because I wanted to focus on the Fulani people. For example, women in their menstruation are not supposed to access the water body because they believe that women in their menstruation are not pure or they are not clean. And accessing the water body can trigger the water or the spirit in the water to cause certain misfortunes in the village. So when a woman is in the menses, they are not supposed to access the water bodies. You see, And until recently, where Christianity and other forms of religion have taken space, people would avoid the water spaces when they are in their menses because they believe there could be a lot of implications. So, for instance, if I am living alone in Bamboy, as somebody who doesn't come from Bamboy, and I am in my menses and I have drawn attention to the general water scarcity problems in the village, then it means I cannot access the Blackwater River for water. So obviously, water access issue is there. So if I also have a young child who cannot go to the river because the river can sometimes be catastrophic, it has drowned people and so many things, then it means our household will not have access to water. So there are so many layers in there. I hope you get it. And also, they believe that people cannot send black pearls to the river. So, for instance, if I don't have financial resources and that is the only port I have, then obviously I can't have access to it. So, one thing is that the river is somehow open access, but you see that there are a lot of people around the entrance that somehow safeguard people who access the water. So, when all these dynamics are in place, I mean, if I'm menstruating, nobody will see I'm menstruating. I can go there. But within me, there has been this kind of conceptualized worldview that I will try to avoid that space. But when it comes to the black pot, it is obvious. Somebody sees that you are sending a black pot there, so you'll be driven back. So the conversation can go on around the taboos and how these things deny people access to water. Thank you.
Thank you, Vivian. Thank you for this chair. Anyone else? Yeah. Yes, please. Yes, please.
May I have some observation on your very interesting, rich data?
Yes.
And this is on ontological and epistemological assumptions. It's more methodological in the sense that I wonder whether you are pursuing abductive logic of inquiry, because the conclusion which you arrive at in case of pursuance of abductive logic of inquiry would be very different than inductive or deductive as such. So that is why methodologically, ontological and epistemological issues cannot be unresolved. That has to be resolved. This is my observation about your rich data. Thank you.
Thank you very much. Thank you.
Thank you. Thank you, sir. Anyone else on the floor? Any questions, any sharings, any observations? Okay. If no one, I would like to conclude this session. Thank you once again, Vivian. I would now like to make the closing remarks. Thank you to all our presenters in the evening today for sharing such rich and thought-provoking insights. Today's session beautifully captured the layered ways in which gender experiences are shaped, gender narratives are shaped. I would also like to acknowledge the powerful perspectives from international voices that have connected the global framework with local realities. As somebody who's also been working in the community, working directly with communities, I especially resonated with the call for ground level accountability, inclusive program design, and the need for safe spaces for girls and women in schools and public settings as well. So thank you for sharing those perspectives as well. These are some of the issues that were shared in the presentation today were shared issues, and they do demand shared solutions. With that, a very heartfelt thanks to all the speakers, organizers, and the participants, and to MANUU for creating this platform to spotlight gender, health, and equity. Thank you once again. Thank you, everyone.
Good evening to everyone present here. So it is high time to wind up this session. Before concluding, I would like to formally deliver the vote of thanks for the chair, Anju Arora, and all the paper presenters who have joined us online from UK and Ghana. I would like to thank all the participants, the volunteers. Before concluding, I would like to call upon Shahida ma'am to felicitate our chair with certificate and shawl. Please, ma'am. Thank you all. I would like to call upon Professor Abdul Mateen sir for concluding remark. Please, sir.
Good afternoon, everyone. It's unbelievable but true that in such a short time, in spite of many constraints, such a big event could be really worked out. Very successful indeed because of the quality of papers. Most important is that, one part is over. We had a very successful 2 days international conference. Truly lots of inputs, quality inputs. Now the second phase is that we are seriously considering for publication. And believe me, if we don't do it within a couple of months, I would consider December as the deadline. And if we want December 2025 to be deadline, then by the end of if not September, then definitely by mid-October, the revised paper must be submitted by all the participants who are interested in publication. We have not yet decided whether to go with Sage or Cambridge Scholar or Global or some other publishers, but that will have a meeting very shortly, and we'll decide which publisher will be the most appropriate, keeping time into consideration as such. We're extremely grateful to the Honorable Vice Chancellor of MANUU for timely help, and other administrators for facilitating in such a short time for this excellent hospitality, accommodation, and good quality food. At lunchtime, someone was highly appreciating the lunch, good biryani. Hyderabad is famous for food in addition to many other things. Charminar is charming, but food is equally, delicious, unforgettable. And with food and good stay, when hospitality gets added, then, it becomes really, truly memorable for visiting what I call this MANUU, home away from home from me, for me at least. And I'm sure that many of you must have had a good time here. Please do help us in getting quality publication. For that, revise it and submit it to ZIA at the earliest possible, ideally by mid-September, but no way it should be after mid-October. Thanks.
Now, I would like to call upon Dr. James Yaudin sir, seminar convener, to say a word of thanks.
Okay, that's it. Any feedback? Anyone want to? Okay. You want to say? Yeah, Professor Parthiva, a quick feedback, please. One, yeah, please.
Respected convener, Shahida ma'am, Jia sir, and Mateen sir, and just chairperson ma'am, and all of you. I'm very much thankful for conducting this, that means a wonderful and new topic that we are in digital age, and now digital health is become one of the important, that means topic for all of us. And now we are in the digital, and health practices, health initiatives are in the digital. I'm very much thankful to choosing this, that means very, we say that very prominent or very relevant relevant topic for this seminar. And in case of hospitality, actually, I got opportunity to come here, but it is in 50-50. But lastly, I reached here and I got this hospitality and food and all of yours, that means friendly. And so I am very much thankful. And sir has said that publications promptly we will send within the time. And that is a good asset for us. Thank you for conducting this seminar.
Thank you so much, Professor Parthiba. She is from Sociology University. And all my young friends from University, Maulana Azad National Urdu University. Many of you are tired, feeling to be sleepy, but I am sure after this last session, which is almost finished, you will be very happy that you have conducted a very wonderful, excellent discussions, and you witnessed this historical debate on gender-based digital initiatives, which would be really a kind of outcome would be coming in next 1 year or 6 months. Let me quickly take 2-3 minutes to say my sincere gratitude to all the resource persons. Everyone, if I am all right with my memory, Professor Parthiba, Dr. Paro, Dr. Namrata, Dr. Sangeeta, Professor Veena, Professor Amity, and Dr. Vishakha, Resma, Akansa, and all the chairs from the locality in Hyderabad, and most specific Professor Abdul Mateen, Dr. Sazia from Aligarh Muslim University for coming. And, we were very happy to see the diversity as well. People came from Southern India, from our side, from Northern India, and also Western India. And Professor Abdul Mateen represent Northeast as well, from Meghalaya. So that brings a feeling that we would also have a vividness into the papers-based, field work, which is coming from and possibility of coming from different states of the India. Therefore, I thank you all of you individually for taking your time, listening, and really giving your contributions to this. And let me also thank very specifically to some of the friends who joined a little late, but Arvind and Diksha has always been very vocal. They say, anytime you call, I'll be there. So Arvind and Diksha, thank you so much for coming here, despite of her illness and making some presentations. All the remaining are the host. So thank you all. Greetings to all of you, students from School of Arts and Social Sciences. I would not say Sociology and Center for Women Education, rather than from the entire School of Social Sciences, and some of you are also from other social sciences, other school of the university. This is my 18th or 19th year of service in this university. I started doing some teaching since I had not finished my PhD. I was about to submit, and this is the first event. I would have done more than 20 events, major events. This is one of the events where I have witnessed till last session research scholars sitting and MA students sitting. Usually at the last session, only organizing team, 2 rows will be there. So hats off to you. And I'm sure that the future of this university is in a good hand. You all will be wonderful ambassadors of the university. So greetings and congratulations for doing wonderful. More especially, master students listening to all these presentations, that's really commendable. And for the guest, you would be appreciating that our students, large number of them are, or many of them are from first generations, bilingual Urdu and English medium education. Despite of that, you have burdened yourself listening all English speakers. तमाम अंग्रेजी वालों को सुना, आपने अपने आप को बर्डन किया और उसको बेयर किया. That makes a lot of sense that we are growing, we are maturing. So I'm happy. A person who thought that this is not going to be possible, but you all made possible. Let me thank staff, Saik, Imtiaz, Amina, if she is around. Amina? Yeah, please give a clap to her. She was the person who was writing email, asking us and writing all the emails, and she'll still be writing you for all the remaining works. Imtiaz, Ahmad, they are not here in this hall, but please convey. I thank the entire guest house. All friends, this is again another remarkable that we got 2 days entire live coverage, which is generally not happening these days. Instructional Media Center team were sitting throughout last 2 days. Obaid, Hasmat, Munir, Satish, all of you. Basit handling all technical teams, coming from 30 kilometers every day, and then he was there. So thank you, Basit, for आपका बेहद शुक्रगुजार हूँ. Second last, Professor Shahida, the eldest mentor in this school, the dean. I'm sure we will find a very happy moment when you are superannuating this month with this successful event and dedication tribute of the seminar to your superannuations in the area which you have worked for decades. So that makes a lot of sense to us, and inshallah we will be coming up with a volume. And the entire university, our Vice Chancellor, who was unwell, sir, sent us a greetings. He was very happy when I shared that the seminar went very successful. I thank the entire administrations for giving all free hands, handling everything. And also I thank all the family members, anyone who is spending whole 2 days, that they allowed you to sit for entire day here, including my family. So thank you so much. My child was unwell, but I was allowed to sit here throughout the. Thank you, everyone. And the 2 students, my dear students, Sadaf and Saad, who has been writing reports, they gave me 10-page reports. 10-page reports. I thought, aap log so jayenge ab. So I thought we'll skip, but the report they have prepared, I'll share all of you. Maybe this becomes a kind of recommendation or something. So thank you, both of you. You did very commendable work and quickly passed on. We'll share those for news coverage tomorrow. So that's all from Maulana Azad National Urdu University on behalf of Center for Women Studies and Department of Sociology in association with RC30 Digital Sociology of Indian Sociological Society. Please join RC30 for a life membership that will make you more into venturing digital sociology, digital India, and dreaming India into digital world through social science perspective. So thank you so much once again, and I also thank all the viewers, people who watch Instruction Media Center, our channel, for this. That is really very, very helpful. Anju Madam, sparing half a day of yours here was really very helpful, and extending your stay beyond these sessions. Thank you, everyone. We will break now and conclude with this with National Anthem. If I can request you all to rise. After that, we'll have an informal certificate distribution. Thank you all. Jai Hind.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
All volunteers can quickly come. We want to distribute certificates.